In this module today, I'm going to talk about everything you need to know about fat loss on a science and numbers basis. It's so important to put that bit at the end because, of course, we know that fat loss is multi-layered when it comes to our habits, our environment, our boredom, our medical conditions. All these are very, very important towards fat loss, but I do feel if people have a good grasp of this, and the understanding of this can be quite blurred due to, in my opinion, the industry confusing it through different methods and maybe different scopes of practice with regards to, that can be slightly biased towards what they want you to do. But if we understand that all diets lead to this, it will make a hell of a lot more sense going forwards, okay? And I think post-weight loss surgery, it's not so relevant in the early stages because the tool is so efficient at allowing a calorie deficit to occur. But certainly as the journey goes on, the numbers could be good to know, and also good to look at reflection as to maybe why weight loss was more aggressive in the early stages and why, sort of water weight can be a factor as well. I'm going to talk about it all today, and I really encourage you to go away and utilize this, work out your own numbers. There will be times when you look at it and go, that's not me, doesn't make sense. But as the video goes on, I think you'll find how it will make more and more sense as the video goes on, okay? So today, and I've just realized I've got to talk upside down, which is not easy, but today I'm going to talk about Tina. I think it's important to personalize these things, and Tina weighs 250 pounds and her goal is fat loss, okay? Now, the first thing to figure out when it comes to that is there are certain formulas that will allow us to work out how many calories Tina should be having on a day-to-day basis to maintain, whether she goes over that, under that, whether she puts on weight or loses weight accordingly. So there's one called the Lyle McDonald formula, which is what one I've used here. There is another one called the Harrison-Benedict formula, this is really important. BMR, basal metabolic rate, is how many calories you burn at rest. What we're after here is not just how many calories we burn at rest, but also how many calories we burn in total, what's called our TDEE, our total daily energy expenditure. And again, that's going to vary from day to day because our movement's going to vary from day to day. But if we're playing with averages, for the basis of understanding here, it works pretty well to use the Lyle McDonald formula, which includes TDEE. So, Tina weighs 250 pounds and she's non-active. This is super important. So what you want to do post-weight loss surgery is go, right, okay, how active am I? Now, of course, this is going to vary quite a bit, okay? If you've got somebody who, struggles to do 2,000-3,000 steps due to knee injuries or fibromyalgia or whatever it may be, we've got to look at the view that we're going to become more active over time, which is super helpful towards weight loss, as you'll see in a minute. But let's be realistic here. If you are somebody whose job is active and you go to the gym 3-4 times a week, you'll be down the higher end. But basically, you want to get your body weight and multiply it by 10 if you are extremely low active, and 15 if you're considered higher active, okay? And naturally, the person who burns more calories day to day is going to have more calories to play with because they're burning more, right? But on this basis, I took the number 11. So she's non-active, she does a few steps or whatever, but she is non-active. So I've taken number 11 and I've times it by her weight, which is 250 pounds, which gives the number 2,750 calories. That is her maintenance calories. Now, take your weight, whatever it may be, whether it's higher or lower, work the formula out, be honest, don't put yourself more active or less active, be as honest as you possibly can be, and that will provide your TDEE, your total daily energy expenditure. Now, from there, that's how we maintain our weight, roughly. And it's worth adding in a sort of side note there, metabolic conditions, polycystic ovary syndrome, thyroid issues can play around with that number, but we need to have an open mind to trial and error over the course of time, and this is a good start point for many people. So, we want to lose body fat, we don't want to maintain, so we need to create a deficit. There is 3,500 calories in 1 pound of fat. People underestimate this. I'll put on the clip here now because I haven't got it with me, but I'll put on the clip here what 5 pounds of fat looks like. It's a dramatic amount, but because people have associations with water weight, they don't feel like 1 pound of fat is very much. So to create a deficit from this, we're looking at 2,250 calories per day. Now, no doubt you're sitting there thinking, post-op I was eating a lot less than that. Yes, you would have been. It tends to be in the first month or so around 500 to 1,000 calories or so. So people are in a very big, strong deficit there. Should be losing around 3 to 4 pounds a week here. And if you look at your average, and this is so important to look at your average weight loss, because just because you're losing 3 to 4 pounds of fat in those early stages, it won't necessarily be reflective on the scales, because the scales don't weigh body fat, they weigh our weight. And of course, water weight is there. And water weight's going to fluctuate, there's going to be certain metabolic changes during that time, but this is why we say go by the average. It tends to tell the true story. And this is why weight loss is more aggressive in the early stages, because not only are you able to consume less food, which isn't the goal long term, we have to fuel ourselves efficiently over time. It's a very low calorie diet. We don't really want to be losing 3-4 pounds of fat throughout the journey, because we need to fuel ourselves with our vitamins and our minerals and our protein and all the things we need as part of our diet. However, the other thing that happens, remember, it's your weight times how active you are. You lose aggressive amounts of weight in the early stages. So this formula changes. It's going to be you're going to be on low, the maintenance calories is going to be lower because you're weighing less. So again, you don't have to keep on working this one out. But if, for example, there's a stall from eating the right amount of protein, from being active, from getting your steps in, all the processes that we talk about, fluids, then it might be worth reworking out and having a little bit of a track. But this is probably 6 months down the line post-op, okay? People worrying about stalls because they've stayed the same weight for a few days, that is going to happen, okay? We need to look at a big picture here. The reason at Tonic we offer an aftercare over the course of years is because we know this is going to happen. But again, if you go by your average over the course of time, it usually works out pretty well. And of course, it's not just weight related, before and after photos, dress sizes, and all the wonderful non-scale victories we talk about. Putting type 2 diabetes into regression, resting heart rate going down, mobility, movement, breathing, confidence all getting better. I've digressed. However, so Tina has decided that she wants to put herself into a 3,500 calorie deficit. She's going to aim for 1,250 calories, okay, which essentially would allow her to lose 3 pounds of fat per week. It might be £5 one week, it might be £1 another, because we know that water weight's going to fluctuate. Go by measurements, body fat tells the story there. Lots of questions about macronutrients. Of these 1,250 calories, there's not a right answer per se. We really encourage protein because it's super important to our health. It's very metabolic, it fills us up, which allows us to adhere to a deficit. And I think prioritizing meals with protein really is the game-winning way to win this stuff, okay? But let's just say 100 grams of protein. People feel like 100 grams of protein is impossible. In the early stages, maybe, that's why we sort of say 60, but we always ask people to have a view to build protein up to 80 to 100. If Tina was to eat 100 grams of protein, it's only 4 calories per gram of protein. So that's only 400 calories. So if she's aiming for, well, I'm going to advocate in a minute, sort of 1250, it's around 30% of her diet. This is not a high protein diet we advocate. It's just lots of people pre-op do not eat enough protein, and that's why metabolically and also fullness wise, it's easier to overconsume on carbs and fats. Carbs and fats aren't the problem, but we want a balance between the two of them. So again, in 1 gram of fat is 9 calories. I've just put 50 as a fairly healthy number to aim for. So 9 for every gram is 9 calories. You times that by 50, you get 450 calories. So now on protein and fat, she's eating 850 calories. And last but not least, you've got carbs. Well, it's quite easy. She's aiming for 3 pounds of fat per week, which is 1250. She is aiming to hit 100 grams of protein. She's got her fat in place. So we just deduct those together, which gives her a grand total of 100 grams of carbs left, which is 400 calories. There is your 1,250 calories. Of course, this is not your result. This is not what I would be saying to you. Some people are cardio type people. Some people are more into their fats. But if we're prioritizing protein, of course, we're aiming for our vitamins and minerals. This is a rough guide how to work it out. But remember, weight is going down. So her TDE will going down, which means even at 1250, she's in less of a deficit the lighter she gets. It's not going to be 3 pounds of fat. It could be 1 pound of fat. Roughly, again, 2 to 6 months, patients are going to be eating between 1,000 and 1,500 calories, which is going to elicit around 1 to 2 pounds of fat. And then going into these stages here, probably about 14 to 1,800 calories, which is going to elicit around 0 to 1 pound of fat per week. Weight loss slows down over time. It is a scientific certainty. But I think with this and the understanding of this, it can really help to long-term progression, but more so because it makes it more of a strategic game, a game of control, rather than a game of emotion. When people weigh themselves and there's not that understanding of water weight fluctuation, there's not an understanding of weight loss slowing down over time, it can really create bumpier roads, which can lead to sabotage and not caring about this, and we can put ourselves in quite a big calorie surplus by not prioritizing protein, over consuming snacks, etc. But roughly, and again roughly, this is not your formula, we need to look into it, work it out for yourself. And again, maybe you can sort of see as well why heavier people tend to lose weight quicker, because their total daily energy expenditure will be higher, because their BMR is higher, because they're burning more calories at rest because they are heavier, okay? Hope that makes sense. I think I've gone through everything there. Yeah, this is actually a lot harder than it looks. But that is the science of fat loss. I hope you enjoyed. Any questions, do let me know anytime. All the best. Goodbye.